our speaker for the seminar on quality and excellence in healthcare is Dr. Gitartha Roymedhi, sir. Though some of us already know about sir, but I want to mention something that sir has completed his graduation from Crimi State Medical University, Ukraine in the year 2009. Then he did PG Diploma in Healthcare Management and Administration from Gurgaon, Haryana in the year 2013. He has been actively working in implementing quality in the healthcare system. So he was secretary of Association of Healthcare Providers in India, especially in Northeast region, and in the area of education and training. He was formerly worked as medical director in Uzbekistan, former CEO, that is Chief Operating Officer of Northeast Cancer Hospital and Research Institute. He is CEO, Chief Executive Officer and Founder Director, ZZ HealthMate. And he is currently working as a Facility Director, Parthona Orthopaedic and Superspecialty Hospital, Guwahati. So, I will not take much time as students are eagerly waiting to hear from you. So, over to you, sir.
So, good afternoon, everyone. So, any one of you feeling sleepy? No one? Okay. So, how many of you are excited to know something new about the healthcare today? All of you? Okay. So, after completing your studies, it is clear that you people are going to work in the field of healthcare, right? So, you all are the future healthcare workers. Am I right? So, you will be working in hospitals. Am I right? So, what you will be doing in hospitals? What will be your role? What will be your responsibility and what will be your task? Just listen from this. I want to listen from anyone, from a student. What will be your role? Nursing? Anyone? Right, okay. That is your basic role, right? For the pharmacy, you sell the dispensing medicine, you will be your basic role. Then nursing, she said that to take proper care of the students, patients, that will be her basic role. So, management, hospital administration, anyone? So, what will be your basic role? Yes, that is what I was expecting actually to hear. That is to maintain the quality of services, because treatment definitely will be treating the patient, but to avoid any type of conflict between the healthcare workers and patients, so we must not only to the reception, not only to those people working in the ward or nurses or technicians, it is applicable to each and every healthcare worker, including healthcare social workers also. Those people who does the counseling for the patient, does the counseling for the patient's relatives, attendants. So it is applicable from the security guards up to the CEO. Everyone, each and everybody, doctors, the physicians, the specialists, consultants, everyone. You got it? Okay. So already my introduction has been given. So currently I am working as a facility director of Parthona Orthopaedic and Superspecialty Hospital. It is located at Beharbari in Guwahati. So are you aware of that place? You know that place, right? So every year before the COVID, every year they used to organize this great summit, including all the major healthcare institutions here in Northeast. So one of my article was published that it was based on quality implementation, patient care and hospital infection control. Are you all aware of this hospital infection control? So do you consider it as a threat to our healthcare? Is it a trick to our healthcare? Suppose a patient come to the hospital for the treatment, okay? Just because of our negligences, okay? Because of our negligences, he gets some infection from the hospital. So who is responsible for that? Right? Each and every staff of the hospital, right? Because the patient, he comes to the hospital to get relief from the pain. So due to our fault, he gets some additional infection and his stay in the hospital gets longer, gets exceeded, right? So definitely he will be losing his health, right? He will be losing his money also. At the end, he will go through mental issues, psychological issues, right? Not only he, his attendants also, his relatives also, those whoever will be visiting him, each and every person related to him will be facing that. So that is why within this quality implementation, within this quality of healthcare, hospital infection control is a very important part. So any idea what we call this hospital acquired infection in other language? Right. And do you know from where this word came, the nosocomial? It's a Greek word, nosocomial. It was later adapted to English, but this hospital infection control, nosocomial, it is a Greek word by origin. Next, please. Yeah. So this is my workplace. So from last almost 1 year, I am attached to this hospital as the facility director there. Next. So I have already said a healthcare center may have the best physician or the finest surgeon, or it may be employed with expert technicians. Unless it is not preventing and eliminating errors, it is not providing the most important service to the patients. If we are not concentrating on patient safety, right? If we are not preventing the medical errors. So have you heard about the word, it's a newly coined word, medical terrorism? Have you heard about that? Yeah. So I don't know either it is justified or not, this word, but this word has been coined because of medical errors, because of the rising cases of medical errors in hospitals, not only in private hospital, even in government hospital also. So this word has been coined, that medical terrorism. So definitely, as long as we are not concentrating, we are not paying attention on patient safety, so we cannot commit a proper care to the patient. Next. Lack of attention towards patient safety measures often leads to adverse effect, and therefore it has become a serious healthcare issue. Definitely, there are many rising cases. You people all know, right? Many rising issues. So have you heard any patient who was on wheelchair but he fell down? He or she, whoever, fell down. Have you heard about such type of cases? Right? Why did it happen? Definitely the hospital worker who is pushing the wheelchair, right, didn't make the patient sit properly on the wheelchair. Right? Have you heard any patient falling down from the bed? Right? Why? Because the one who is dealing with the patient, he didn't made the patient sleep at the proper position. Right? It seems very small things, but it may turn into very serious threats, very serious issues. So that is why I say that patient safety is not an easy task. Many people think that it is a cup of tea, but it is not at all. Have you heard about this fire incident in Emory Hospital in Kolkata long time back in Mukundapur? Anyone aware of that? No one, right? So you know about that, yeah. Okay, so that's why you know it well. So definitely this incident is not related to medication, not related to any technical fault, but it is still related to patient safety. Okay, so rest of the things I will explain you in the next slides. Next. So what is patient safety? Next. Safety, please note it down. Okay, so we'll have to remember this for your whole life. As long as you are into this profession, Healthcare profession, you will have to know this. Safety means sense of error. You should have this sense of the error. Act to prevent it. You must know about the preventive measures. Definitely error will be committed. Might be unintended, not intentionally, but still there are chances. Okay, there will be chances, but you should have the sense and you should know about the preventive measures. Then follow safety guidelines. So do you know about NABS, National Accreditation Board for Healthcare Organization? Do you all know that? NABL, do you know that? That is for laboratories. Okay. So till now in 3 hospitals I have implemented NABH as a coordinator for NABH. So NABH, okay. So NABH has introduced few guidelines in hospitals according to departments. Okay. SOP. Do you know what is SOP? Okay. So you will have to follow those guidelines, those SOPs to prevent any type of errors. Inquire into accidents, deaths. So definitely, if there will be any accident with patient or any death, so you'll have to make the proper inquiry. Take appropriate remedial measures. And the last one, your responsibility. So your job profile, your job responsibility, you'll have to know well if you want to prevent any what? Any what? Errors, right? Any errors. Next slide, please. So whose safety? Now the question is whose safety? So who comes in a hospital? And attendants and working staff and other visitors also, right? Vendors, they do come, right? Medical representatives, they do come, right? Interns, they do come. So lots, okay? So it's very difficult to classify. There are lots. So whose safety? Safety of the people. So safety of each and every individual present in the hospital. Safety of the place. So we have to take care of the hospital building. Then property, right? The machines, the equipments, right? So we'll have to take care of those things also. So when it comes to safety, so always remember safety of 3 categories: people, place and property. Next slide. So safety of the place, it includes infrastructure, fire, electrical and mechanical appliances. Okay, I already have given an example about Mukundapur, that Emry Mukundapur. I have already, it was an accident. Nobody did it purposely, but still it cannot be underestimated. Then electrical and mechanical appliances. So what type of appliances? X-ray machine, right? Or the centrifuge machine in laboratory. Am I right? Not only that, even the AC, fans, lights, whatever we are using in the hospital, each and every electrical and mechanical appliances. So every appliance is important and we'll have to check them well every day so that it should not cause any harm to any patient or the hospital workers. Got it? Yes. Next slide. Safety of property. So safety of property, stores, assets and equipments. Now, what type of equipments are here? I have already said mechanical and technical things I have said, but here also I have mentioned equipments. So what type of equipments are here? Sorry? No, these are the common equipments like stapler, right? Computer, laptop, your intercom telephone. Because when there will be an incident, right? So how we will communicate? Through the intercom only, right? So we don't have time to take our mobile phones and to call our colleagues, right? So where we will call? We will call the reception to make the announcement. So when you will be working in hospital, so you will learn about the color codes. So any idea about the color codes? Right? Color codes. So if there will be a fire, okay, so how we will mention it? Which color? Right. So we will say, suppose I am in a hospital and there is fire at the second floor. So how the receptionist will mention? Code red, second floor. Code red, second floor, right? So that the patients and their relatives, attendants, they can't understand this. Otherwise, they will come into panic. But as hospital workers, it's our responsibility to evacuate them. So what is color blue? Any idea? Very good. And color pink? Very good. So you guys are very knowledgeable. Okay. Okay. Next. So patient safety is a discipline in healthcare that emphasizes safety to the patient in a healthcare center through prevention, reduction, reporting, and analysis of medical error. Note it down. So these four things, following these four principles, we can reduce the incidence of medical errors. The first one is prevention, second one is reduction. How we can reduce? Only after knowing, right? Only after learning about that we can reduce. Then reporting. So most of the time what happens, what I have seen in many hospitals, suppose there is a needle stick injury, okay? There is a needle stick injury. So as per guidelines, as per the protocols, the sister, the nurse, the one who will be on duty or one who performed this injury, so has to report it, has to note it down, has to report it to the authorities, but they never do. But they never do. We always do ask, never recap a syringe, right? You know about that? You should never recap a syringe. But many of the times the sisters, they forget and they do. As a result, they get this needle stick injury. But they never report. But they don't feel it to report. So every time, if there is any incident of fall, okay, any patient fall, either from bed or in the washroom or from the wheelchair, wherever. So there is a protocol to note it down and to report it to the authorities. But the hospital, many of the hospital workers, either they get scared or whatever the reason is, but they never report. Okay, they don't feel necessary to report it. As a result, we don't come to know about this sort of incidents. Okay, that is why if we want to reduce the incidents, okay, if we want to reduce the happenings, the occurrences, we have to report it well. We have to document it well. Documentation is very important. We have to document it well, and after that we have to forward it to the hospital quality manager. Then analysis, sorry, the last one is there, and analysis of medical errors. So you can only analyze when you will be learned about that. You have to know about it deeply so that you can prevent, reduce, report, and analyze it properly. Got me? I can't hear you. Do you get me? Okay, next slide. In last couple of years, almost all the countries in the world increasingly recognize the importance of improving patient safety. Have to. Because as long as we are not going to concentrate on this, the conflict between the patient and the healthcare workers won't end. So do you think that the conflict between the patients and these healthcare workers are increasing day by day? Do you think that? So there are many cases of doctors beaten up by the mob, patients' relatives and all. So why these things are happening? Because maybe there was some medical error. I can't say that there was, but there might be. There might be. So that's why this sort of incidents will increase. Yet healthcare providers face multiple challenges in healthcare environment today in securing the patient's health. But still there are lots of challenges. So we can try to reduce the cases, we can try to bring down the cases, but still there are many challenges. So in upcoming years, when you guys will enter your professional life, you will be working in hospitals, you will be working in healthcare organizations, so you will start facing that, but still you have to handle it as a healthcare worker. Next. So healthcare provider face multiple, So errors in healthcare centers, patient might experience dangerous complication and one can even lose the life unnecessarily. So it had happened. It had happened that patient, due to doctor's fault, due to medical staff's negligence, the patient has lost his life. So when a life is lost, okay, so for us it's a patient, for us it's a body, okay, but for the patient's relative, for the patient's family, it is not merely a body or a life, okay. So they can only understand the loss. So we must have to understand that also, that we have to secure a patient's life as much as we can. If we can't treat the patient also, what we do, we try to make the life, the quality of life little better, so that the patient can live at least a easy life, a comfortable life, a little better, a little comfortable life. Normally it happens in cancer patients. When a patient comes, we at the terminal stage, we cannot treat the patient. So what we do that time, we suggest the patient to go for palliative treatment. And what happens? Just following the palliative treatment, we can at least improve the quality of the life of the patient for some days. So that should be our effort. Next. So hundreds of millions of patients are affected worldwide due to deficiency in safety. So this is the truth. We have to accept that, because many of the patients are losing their life. They are losing their quality of life is deteriorating because of lack in safety. Of every 100 patients undergoing treatment in a hospital at any given time, 7 in developed and 10 in developing countries acquire healthcare associated problems. So as already you all know that I was in Uzbekistan as medical director in a Indian hospital there. So I can't say the things are better there. What I have realized, the things are same everywhere. Patient safety, it's now a global concern, and medical errors, there are incidents, there are reporting of medical errors everywhere. Everywhere. Next. So what is healthcare or medical error? So already I told you. Next slide please. So error is said to occur when a planned sequence of mental or physical activities fails to achieve the intended outcome, and when this failure cannot attributed to some chance intervention or occurrence. So we never harm a patient intentionally, right? The patient might be irritating also, the patient's relative might be irritating also, but we should always keep in our mind that the patient is in pain. His life is not easy and comfortable as like ours. So however he behaves, however he reacts, we'll have to accept that. I'm not asking to tolerate that, because accepting and tolerating are two different things. So not tolerating, we have to accept that. But still, medical errors are committed, right? So any common medical error from nursing point of view, any of the student, please. Just I want to make it a how to knowledgeable session, okay, a bit interesting, so that you don't forget it, okay. So that's why I'll be putting you questions, okay, in between. So anyone, any nursing student? Huh? Sorry? Yeah, wrong medicine, right? So why? How it could happen? The wrong medicine. Thank you. I fully agree. I fully agree. And he also the route of administration. Okay, I want to put. So you should check the medicine thrice, not once, not twice, but thrice. You should check the file thrice. Okay, you should match the medicine and the patient's name thrice. Okay, and you should see the route of administration. How many times? Thrice. Okay, okay. Then anyone from pharma who can bit highlight on this issue? Please, please, any of you, any of you. I'm not going to give you any marks, na? Just no one from pharma here, but I did. I saw few hands that time. Okay, from pharmacy. Okay, so what might be the errors there? Sorry. Yeah, okay. I'm explaining you all that in pharmacies what happen most of the times as per NABH protocol. So you should keep the short expiry medicines and the normal medicines in different places. You should check the expiry dates of the medicines regularly. Okay. So there is a process to discard the expiry medicines. Sorry, a bit louder. I can hear you. Yeah. Yes, that is true. Sometimes, not sometimes, most of the times. Okay, because even my pharmacist also he have to come to me frequently to ask what I have written there. Okay, because my handwriting is not good. I am telling frankly. Yeah. Sorry. Okay, you have experienced it. Okay, thank you so much. So that's the thing and sometimes what happen, we always ask to put a note, put stickers on the look alike and sound alike medicines. Okay, so many times it's not done because in private pharmacies I didn't see anyone putting those stickers. Okay, that's why errors are happening. But in hospitals, they are following because of this NABH guidelines, as per the NABH guidelines. Otherwise, they won't get this certification. Next. Healthcare or medical error is the major threat in the case of patient safety. Most of the occasion, these errors are preventable. Errors are preventable. I'm not saying that in every case, but in most of the cases. Healthcare institutions and hospitals must work hard every hour to protect their patients from errors, injuries, accidents, and infections. So when we talk about errors, so the patient might experience injuries, unnecessary have to face unnecessary accidents and unnecessary what? Infections. And that is what I told you at the beginning. Which infection? Nosocomial infection. Right, thank you. Next slide. Rise in incidence has made a common man to describe our healthcare system prone to errors and detrimental to patient safety care. Definitely, our patient's feedback matters a lot. People will check before coming to a hospital, right? People will check the reviews in Google, right? They will see how much trust the hospital is having, right? So definitely, if a patient will give a bad review, definitely it will affect the other patient. That patient won't be willing to come to that hospital again. That is detrimental to what? Medical errors. That is not committed to patient safety. Next slide. Okay, the next. Okay, the current environment. Okay. So what is the current environment? Errors and system failures repeated. It's happening, right? The errors are repeated, the system failure is repeated. Then action on non-risk is very slow. It is slow because we are not putting any effort on that. We are not thinking about that. We are not concentrating about that. हो रहा है, होने दो. जब तक कुछ बड़ा प्रॉब्लम नहीं आ जाता, let it happen like this. Am I right? Detecting system in their infancy. Many events not reported. I told you already that many events are not reported. Understanding of causes limited, right? हल्का फुल्का सीख लिया, that is enough. उससे ज्यादा नहीं सीखना है. Am I right? Then few examples of successful scale up. So just few successful examples are enough for us, right? We don't want to go beyond that. So that's one. Then blame culture, alive and well. Blame culture. If anything happen, no, the ward nurses are guilty. Then ward nurses will know the ICU nurses are guilty. Then ICU nurses will know the OT nurses have sent the patient like this. So at the end, the blame culture will go on, and the result will be a 0. And who will suffer for this? The patient. Then this deficiency and this insecrecy. So as reported, they won't be reporting about the incidents, they won't be reporting about the errors. Definitely they will try to maintain the secrecy, and we won't be knowing about these errors. At the end, the patient will suffer. Next slide. So what is quality care? Patient safety is an essential and vital component of quality care. So patient safety indeed is the key component of quality care. Safety means to do safety means to do with lack of harm, avoiding bad events, and making less mistakes to happen. So as I said, that we cannot eliminate it completely. It's still a big challenge for us. But still, what our effort should be to do something good to the patient without minimal harm. Because if we are giving an injection, if we are injecting a patient, okay, so we cannot say that patient will not have any pain. The patient will have pain, right? We cannot avoid that. But our effort should be to do minimal harm, minimal. We should not do any intentional harm. But those harms that cannot be avoided, cannot be prevented, we should try to do it at the minimum. Avoiding bad events as much we can, we must try to avoid the bad events. Suppose if you are administering a IV injection, okay, something IV, and you are not getting the vein, don't make it an attitude or ego, okay? Don't make it. If you can't do, just inform the other nurse. Let her do. If she can't do, okay, inform the duty doctor. If the duty doctor also can't do, okay, inform the ICU doctor. He's an anesthetist. He can do it well. Okay, that should be the work culture. So if you will take it to yourself that no, if I will call the other sister, she will say that I don't know how to administer a IV the injection, a simple IV injection. So definitely your ego will be with you, but the patient will suffer. Right? Yeah. Next slide. Patient safety is an important element of an effective as well as efficient healthcare system where quality prevails. Note it down. So shall I move to the next slide? Okay, next slide. Quality is doing the things well to provide efficient, effective and purposeful care and to get the task done at the right time. Always right patient at the right time. You know that? Right patient, right medication, right time. 3R. There are 2 more R's. I will get it afterwards. But right now, right patient, right medication, right time. If you have to give a drip to the patient, so you'll have to see the time doctor has advised for. So you cannot delay or you cannot do it in advance. Okay, so time matters. So you have to, if you are working in OPD, if you see any patient coming to you, talking to you, so you have to analyze the urgency. Because every patient will be in hurry, okay? They don't have time to wait. But which patient is important, which should be attended first, that you must have the talent to analyze the level of urgency for the patient. Usually errors are not committed intentionally. I told you, nobody commits an error intentionally. Errors are either committed purposely or unknowingly. In both the forms, it is harmful for a patient. There are various factors behind the medical error. There are various factors. I will go to the factors now. But whatever, no one will check either it is done intentionally or unintentionally. But it has been done. It has been committed. It happened. It has harmed the patient. So everyone will be responsible. When some harm is done to a patient, the entire team of healthcare providers and workers become responsible. It includes physicians, nurses, administrators, managers, ward boys, technicians, cleaners, etc. Each and everyone, I told you already. Next slide, please. To some extent, the patient or their relatives are also responsible, like in the cases of self-medication, going against medical advice, or violating a physician's right. So, to some extent, the patient and their relatives are also responsible, because they don't feel like calling the nurse, they will give the medicine themselves, right? Sometimes they don't feel like they think that if they will get the medicine outside the hospital, they get it for a cheaper price. So they do go, and the outside pharmacy, they will give a different medicines, saying that this is the same medicine. Like that, it happened, I have seen such cases. Okay, so that is the thing. And sometimes they get irritated, they get fed up, so definitely they will not follow whatever the doctors ask them to. So that's how definitely it harms the patient. So in this matter, the patient's relatives are guilty for this, for any type of harm to the patient. So you will see in hospitals that we always do right there, we always do put up two boards there. One is patient's right and responsibilities, one is physician's rights and responsibilities. Have you seen in hospitals? Yeah, as per Clinical Establishment Act, it is mandatory, as per NABH also. The best way to prevent medical errors: active and skilled communication. Communication between the healthcare workers, between the patient and healthcare workers, between the patient's attendants and healthcare workers is very important, and this is the way you can prevent the medical errors from happening. So what happening nowadays due to the busyness? Okay, so there is a lapse between the patient's relatives and doctors, between the patient and doctors. Okay, a physician, they are always busy. Okay, if the patient this attendance will ask 10 questions, they will answer only 2. So what about the rest of the 8? So that's why the hospitals, they are employing with healthcare social workers or clinicians, physicians assistants, so that they can help the patient in getting their distinct questions answered. So, but still, not every hospital, that's why the lapse is still there. So communication, active and fruitful communication must be practiced in every healthcare organizations. So you had asked about the conflict, right? So I'm just telling you that communication, okay, active communication, sharing your problems, okay, can bring end to any type of conflict, or it will prevent conflict. You got me? So I always do talk to my staff, no, personally, so that unless I won't be knowing their problems, so I won't be able to help them. Right? Every person has his own problem. So definitely if it's hampering our work culture, so definitely I have to know about him. So why he is not working properly. So once we will know about the problem, then only we can get the solution. So always do remember, not in healthcare, but mostly in healthcare, that problem is not, the solution is not away from the problem. If you can detect the problem, if you can analyze the problem, definitely the solution is with the problem only. But you will have to know the problem well. So you might not able to provide the best services, but you have to ensure the patient that you are providing the world-class quality. Then only the patient and the patient relatives will be impressed. Okay, they are not having CT scan, they are having X-ray, but they are having the best X-ray. They are not having ACLS ambulance, but they are having a BLS ambulance, but their BLS ambulance is too good. Got me? Yeah. One should immediately speak up if something that is not right or safe is observed. If one do see any medical errors in healthcare centers, he or she must inform the nearest healthcare employee to connect him or her to the one who can investigate and resolve the issue, the problem. I told you already. Next slide. I have said already that coordination between the healthcare workers and patient attendants is very necessary. Okay, the issue must be discussed in a respectable and peaceful manner. So never get aggressive. Okay, whatever the patient or the patient's relatives they want to speak, you have to listen it properly in a peaceful manner and in a respectful manner. So self-respect, your own self-respect is also mandatory, but you will have to respect the patient and the patient's attendants also, those whoever are communicating with you all. If the complaint of the patient or its attendant is not responded or recorded, they deserve the legal right to file a complaint against the particular healthcare center. So the patients and their relative, they have the right to sue you, okay, if you are not responding to their issues, to their problems. Many healthcare centers has established systems like suggestion box, emails, or hotline for reporting of errors. Such services should be utilized to report about problem that it can be addressed. Okay? Receiving the problem is not everything. Receiving the report, receiving the complaint is not everything. So we'll have to address it also, right? So that's why the hospitals now, the healthcare organizations, they have established, they have started new techniques like the email or this. We always take patients' feedback. Do you all know that, right? At hospital. Why? So that we can improve our quality of services. We can improve the quality of services through getting the patient's feedback only. So that's why for their valuable feedback, we do ask them, we do request them. So if some patients, they don't like to give it there in the hospital, so always the hospitals, they have a hotline number or they have an email, okay, where the patient or their relatives can share the issues. Next slide. There are various factors behind medical errors. So let me highlight. The most common is the human factor, that includes variation in healthcare providers, training and experience. Sometimes we hire untrained, not fully trained employees or not with experience. Sometimes fatigue, depression and burnout because of workload or some other issue, family issue, okay, some personal issues. So many of the staffs, they do feel problems like fatigue, depression and or burnout. Increasing working hours. So if we pressurize an employee to work more and not paying overtime, okay, so this sort of things happen. Like then I have also mentioned the time pressure, right? If the hospital worker, he prefers to work from 9 to 2, but we said no, you have to work from 2 to 9, like that. So that time also there are various factors. Unfamiliar settings and failure to acknowledge the prevalence and seriousness of medical errors. So I told you that unfamiliar, suppose you are joining a new place, so it will take you time to get adjust, right? So those sort of things are also there. So not having means this thing, sometimes the ego issues also, that with the co-workers, not a friendly relation with the co-workers, right, or not taking this issue of medical errors seriously. So these are the human errors. Next slide. The second one is the system failure, or that includes inadequate system to share information in a healthcare center, infrastructure failure, environment and design factor, poor communication between healthcare workers, disconnected reporting system within the hospitals. Suppose there is some fault in the computer, right? We cannot keep the records. If we are not having a proper reporting system, so how the healthcare workers will be reporting on any incident? Right? Suppose if our AC is not working properly, then how we can conduct a surgery? You got me right? Suppose our intercom is not working properly, then how we can convey a message in case of emergency? So these are also things that we call is system failure. So every day I told you that quality manager's role is to check each and every equipment, each and every machineries in the hospital, so that there should not be any harm to the patient. Next slide. The third and the last common factor is medical complexity, that is related to powerful drugs, complicated technologies and prolonged hospital stay. I told you already, right? Related to drugs. Next slide. Practicing effective communication is essential for ensuring patient safety, as the practice plays a great role in promoting and protecting patient safety. I have mentioned already. Next. So there are several techniques, tools and strategies used to improve improve communications. To increase the quality of communication, regular feedback should be provided. I have mentioned already. Next slide. One of the most significant problem is with the current healthcare system is the failure to make safety and quality information available to the common people. So that is what we have still failed, okay, to convey it regarding safety, regarding this safety tools to the patients. Next slide. A common man has the right to information to make the correct choice. Okay. So a common man has the right to make the correct choice. So he has the right to select the hospital. He has the right to select the physician. Right? He has the right to select the mode of treatment. Next slide. So prevent medical errors by medical staff. So you all please note it down. So I will be discussing few points. Okay. Communication and coordination, deflects drive errors, application of aviation safety concept and skills are being introduced in healthcare. Strong correlation between teamwork results in improved patient outcomes, patient satisfaction. To run a whole healthcare organization, we must have patient satisfaction, right? Patient should express their level of satisfaction. Then staff satisfaction, that is also important, because without the staff satisfaction, we cannot provide the quality care. Then reduced errors, reduced malpractice claims, reduce blame culture. Blame culture, again I will come to that. Never adopt that practice, blame culture, because it will spoil the entire environment, your entire environment of the workplace. And definitely reduce malpractice claims. Don't ever support the malpractice, or don't ever follow that. Okay, it will not get you anything. Okay, shall I move to the next slide? Oh, you are writing? Okay, okay. Just note it down, note it down. Shall I? Okay, next slide please. Practice of patient safety, be aware of look alike, sound alike medication names. Note it, although you all know, if you want, you can note it down. I have mentioned earlier, proper patient identification. I have said already, explain in details during patient handover and takeover. That is also important during the handover and takeover. If you are taking the handover, listen attentively. If you are giving someone the handover, explain it properly. You should not miss out anything. Explain the performance of correct procedure at correct body site. Be aware of that also. Correct procedure at correct body site. You got me now? What I mean to say? If you have to give a stitch, if you have to administer an injection, so you have to know about the correct body site. Careful about electrolyte imbalance, then assuring proper treatment while during shifting. Avoid catheter and tubing, wrong connections. It happens. It happens while inserting a tube or while inserting a catheter. It happens. Then single use of injection syringes, never reuse. You know that well, right? Improve hand hygiene to prevent healthcare associated infection. After COVID, everyone is aware of that. You should sanitize your hand, right? Before touching the patient, after touching the patient, both. Before touching the patient's belongings, after touching the patient's belongings, in every occasion. Proper disposal of BMW and good housekeeping. Practice surgical safety guidelines. I say the guidelines you have to follow. Now tell me, what is BMW? I have mentioned proper disposal of BMW and good housekeeping. So what is BMW? Very good. It's biomedical waste, and that is a source of what? Infection. So proper disposal of biomedical waste is very, very important, right? Maintenance of the biomedical waste room is very important. Whenever anyone comes for the inspection, either it's from the pollution control department or NABH or QCI, whoever, they will first check your hygiene, the hygiene of the hospital, how hygienic the hospital is. They will check the bins, right? They will check the bins. So how many bins are there? Color coded bins. Okay, just mention the colors. Red, am I right? Yellow, blue, green. Green is for what? Very good. Then what for white? Do you use white also? Puncture proof one? For what? For the needles. Okay. So shall we use any chemical over there? Any solution over there? Very good, because as per the pollution control protocol, they do use, they do ask 1% is hypochlorite to be used, but as per NABH, we don't need to use any solution there. Just we need to keep the needles there. Okay? So once it is full, we have to discard it as per the guidelines. So what is yellow for? So suppose if we have to discard a medicine, where we will discard it? Medicine, expired medicine, okay? So where will discard it? Expired medicine, suppose expired tablet, a strip top tablet that is expired, okay, has crossed the expiry date. Where will discard it? It's in yellow. Always do remember, I have seen these mistakes done by our hospital staffs, that expired medicine, it should be discarded in yellow. Okay, so anyone from any laboratory, anyone doing laboratory technician, anyone laboratory technician, this thing, our future laboratory technician, anyone here? Okay, if it is a blood bag, okay, use blood bag. So where we will discard it? Straight from the patient. After disconnecting with patient, we will discard it to yellow. How? Yes, you will have to autoclave that first. That bag, you have to autoclave that first, then you have to discard it in yellow. You are partially right, thank you. Okay, so lots are there. Sharp blade, where we will put it? Okay. Right, blue. And bottles, pieces of broken bottles, where? Sorry? If glass, it's blue, right? You are right. Blue. Okay. So there will be lots of examples. Okay. I won't go down to that much. So that is the thing. BMW and good housekeeping. So linens, then other utensils should be also hygienic to prevent any type of infection. So do you think we should sanitize the patient bed also? Right? So do you feel it necessary to fumigate the ICU after every 2 days? Right? Okay. So how many times our instruments will be autoclaved? Once daily. It is mandatory. But if there is emergency, so they might have to do it more than one time also. Got me right? Suppose we are using that instrument for one patient after autoclaving, after sterilization. So we should not wait for the next day. Again, the doctor will come, we will autoclave it and we will offer it to the doctor. That patient might have some complication anytime. You never know. So better after doing autoclave once, so we should not keep it to do it for the second day, on the next day. Okay. So we should autoclave it and to keep it properly. Suppose if there will be any emergency, so the doctor can come and he should not make any delay while treating the patient. Got me? Okay. The next slide. So tips for improving patient safety, constitution of patient safety committee. So every hospital should have a patient safety committee. Our hospital is also having, and we are also now just spreading this awareness that every healthcare center must have that committee, patient safety committee. So second is develop clear policies and protocols for patient safety. I told you there are guidelines, there are policies and protocols that you have to follow after joining a hospital. Discuss regularly patient safety initiative within hospital staff. That's why every hospital nowadays, including our hospital, every week we do have a training session of our staff regarding these issues. Reorientation of hospital staff on patient safety. I have said already. Encourage transparency in regular debt review. Have to. Okay, there should be transparency, because there is nothing to be hidden about nowadays. For every debt you have to report to the government. In government portal, you have to upload that regarding any debt. yeah, no, this thing, lack of this thing, no, incident reporting by staffs, I have said. Then each department to devise their own patient safety protocols. So every department must have their own protocol to prevent the medical errors and to promote the patient safety. Review, monitor, and evaluate patient procedure, patient safety procedures regularly. Then investigate each accident, incident, report it, and take remedial measures. If there is any, we have to investigate, we have to report, and we have to think about the solution. Next slide. I think enough for today. Are you all tired? So, was it effective? Shall I consider it to be a successful one? Okay, thank you so much. Thank you everyone, all the faculty members and the management. And my special thanks to Nishan because he is the one who has connected me with this institute. So thank you so much everyone. Okay, so wish you a better future. Okay, thank you. Yeah, please.
Good afternoon, sir.
Yeah.
My question is the hospital, the Parthona hospital was established in 2021.
Yeah.
So it already established in community. So what are the strategies to connect with the community?
Yeah, very good questions. Actually, what we are doing, Parthona Hospital is actually one of the or means dedicated, how to say, ortho super specialty. You can take a seat, no issues. Actually we had opened when we started, it was a ortho setup. Okay, so actually what we have seen is people from our region, they are going to Patna mostly for any ortho treatment. Okay, following any fracture, okay, following any spine surgery, they are traveling to Patna. So just we wanted, as a part of quality services, we wanted to reduce this gap. Okay, we tried to reduce this gap and we have started this hospital with this intention so that our people, they should not go to Patna or any other place for treatment and to drain their money. Okay, because only the affordable people, they do only travel, but still that's why we got the entire team from Patna to our hospital. So what we are doing now, just we are organizing few awareness programs in remote areas. Okay, so we are doing free BMD, that's bone marrow density test, free of cost for elderly people. Then we are organizing health camps in rural areas. So that is how we are trying to reach the communities. Okay, yeah, thank you. Any more, please?
Good afternoon, sir.
Yeah.
My name is Lila. I'm in first.
Mhm.
Sir, we went for summer training in the Nemcare hospital, and there our teachers and faculty that for the management team. So the most challenging part is dealing with the doctors.
Yeah.
So what's it all about?
It's really very tough between the management and doctors. I know that the conflict will be always there. Okay, so what the things, yeah, you can please take a seat. So it's not only in Nemcare, in every hospital you will see that. Okay, so between the technical staffs and between the non-technical staff, the problem will be always there. So what we do, the hospital, what I have said, the regular training sessions we are conducting, we are organizing every week. Okay, so we do invite these consultants also there, we do invite the medical officers also there, so that we can have a common discussion on a common platform. Okay, but still the conflict is there. Still the conflict is there because you see, I'm not talking about these management people and doctors. Between the doctors also the conflict is there. So when it's a matter of cancer patient, definitely medical between the pain specialist and medical oncologist, there will be the conflict. If a patient in ICU, definitely the critical care doctor, the medicine doctor and the microbiologist will have a conflict regarding the medication of the patient. So it will be there, but what we can try is to reduce the lapses, the gaps. Okay, that's why we are organizing these training sessions and this discussion sessions so that we can reduce the gap as much we can. Okay. Yeah, please. Yeah.
क्वालिटी हॉस्पिटल के अंदर क्वालिटी कंपनी मेंटेन करने के लिए बहुत डिफिकल्ट होता है। तो आप लोग जो पार्टनर की लास्ट ईयर एस्टैब्लिश हुआ तो इतने सस्ते एनिमेशन के अंदर भी आ गया तो कैसे वो क्वालिटी मेंटेन करते हैं प्रोजेक्ट कैसे मेंटेन करते हैं वो क्वालिटी
एक्चुअली इट डिपेंड्स, मैंने बोला पहले भी कि कई हॉस्पिटल में क्या होता है, डेफिनेटली दे डू, मैं ये नहीं बोलूंगा कि फ्रेशर को हायर नहीं करना चाहिए, बट इसमें क्या होता है दैट एक्चुअली वी टुक इट एज अ चैलेंज कि एज अ 6 month ओल्ड हॉस्पिटल इफ वी कैन अचीव दिस गोल कि NABH मिल जाता है, then we can make the people know that yeah, we are committed to patient safety. Okay, as I am also related to NABH from a long time, मैंने बताया already that is the third hospital जिसमें मैं मतलब NABH में involved हूँ. Then I got my entire team here, those who were trained in NABH. So what we did in my previous hospital also, when we did this NABH, so we had dedicated 3 months only for NABH, a special team. The same चीज we have repeated here also. सो हम लोगों ने पॉलिसीज बनाया, हम लोगों ने SOPs बनाए, स्टाफ को ट्रेन किया. ओके, सो मोस्ट ऑफ द स्टाफ फ्रेशर्स, बट स्टिल सबको ट्रेन अप किया. ठीक है, तो सब ये नहीं कि SSR आने के दिन ही पहले दिन ही वो लोग ट्रेन अप हुए हैं. सो फॉर 1 month दे वर कंटिन्यूअसली प्रैक्टिसिंग, जो हमने उनको सिखाया वो लोग प्रैक्टिस किया है. एंड नाउ द थिंग इज दैट दे हैव अडॉप्टेड दिस कल्चर. तो डेफिनेटली इट्स नॉट एन इजी बट इट्स नॉट इम्पॉसिबल. इट्स अ वेरी ह्यूज चैप्टर. इसके लिए NABH का एक बहुत मोटा किताब आता है. ओके, सो इट्स अ वेरी ह्यूज चैप्टर. लेकिन हर एक डिपार्टमेंट का अलग प्रोटोकॉल होता है, अलग SOPs होते हैं. ओके, सो सपोज मैनेजमेंट का अलग है, यू हैव टू फॉलो दैट. तो NABH में मैंने बता दिया, तो डॉक्यूमेंटेशन सबसे इंपॉर्टेंट है. वो लोग ये चेक करते हैं, वो लोग HR से स्टार्ट करेंगे, दे विल स्टार्ट फ्रॉम द HR, दे विल स्टार्ट फ्रॉम द एडमिन. उसके बाद ही वो लोग डॉक्टर्स तक जाएंगे. दे विल चेक द पेशेंट्स फाइल, हाउ इट इज मेंटेन्ड. देन वो लोग देखेंगे, पेशेंट के पास जाएंगे, हाउ द नर्सिंग स्टाफ्स आर वर्किंग. जो ड्रिप जा रहा है उसमें नाम एंड टाइम लिखा हुआ है कि नहीं, हर पेशेंट के हाथ में वेस्ट है कि वो, ये मतलब बेल्ट है कि नहीं. ओके, दैट रिबन है कि नहीं. ओके, सो वो सब चीज देखते हैं. देन दे विल चेक के रिसेप्शन के लोगों को हॉस्पिटल के बारे, बिकॉज रिसेप्शन को हमेशा बोला जाता है द फेस ऑफ द ऑर्गेनाइजेशन, तो यही चेक करते हैं वो लोग सारे वेल इन्फॉर्म है कि नहीं. फिर वो लोग ऑटोक्लेव देखते हैं. देन इट मींस A to Z. ओके, यू नेवर नो. अगर मैं इंस्पेक्शन के लिए जाता तो सबसे पहले मैं डस्ट चेक करता हूँ वॉल में. ओके, तो इट डिपेंड्स ऑन द असेसर, बट स्टिल ऑल असेसर्स आर स्ट्रिक्ट. सो कहा नहीं जा सकता, बट इफ यू आर फॉलोइंग द गाइडलाइन, जो गाइडलाइंस आते हैं, इफ यू आर फॉलोइंग दैट, देन डेफिनेटली एसेसर आए हैं तो डेफिनेटली वो तो NCs लगाएंगे ही. अगर मैं भी कहीं जाता हूं, जस्ट एज एन इंटरनल ऑडिटर में बात कर रहा हूं, आई वेंट टू GNRC फॉर ट्रेनिंग एज एन असेसर. मैं गया वहां पे, देन फोर्सफुली आई वाज ट्राइंग टू फाइंड आउट फॉल्ट्स. अगर मैं गलती नहीं निकालूंगा, देन व्हाई आई एम हियर. यू गॉट मी ना. तो वो तो NCs तो लगाएंगे, बट दे गिव यू टाइम टू कंप्लीट द NCs. ओके, सो इट वाज टफ बट नॉट इम्पॉसिबल. ओके, थैंक यू. Thank you so much.
Hello, sir. Actually, one last question.
Yeah, please.
Like as you told us regarding any quality, we need to take on feedback. Feedback is very important, and you have said about this NABH. There also feedback is working. Now we are going to apply for NP. There also we need to feedback.
Yeah.
And the B.Pharm students, they are working in the pharmaceutical industry. They will also come to know. They have the FDA inspection.
Okay.
They are also getting the feedback.
Okay.
But being a human being, you find certain patients are in tendency to give the bad feedback. They want always more. And if we have the background, the management will find out that feedback where they have written that.
Yeah.
If you have the background. So in that case, how do you sort out that kind of situations? Like if it is an employee, suppose I am an employee, my feedback is bad. Suppose 80% is people will be good feedback, but 2 feedback is very bad, and management have thought of that. So how do you deal that kind of situation?
Yeah, that is true. I agree with that because I have experienced that thing. Okay, because people, they expect more. Almost 1 in 3 person, the one will be expecting more. Okay, and intentionally they will give this feedback either in social media or Google, wherever. But it depends on the management how to judge that. Okay, so what we do, once we get such feedback, we do call a review meeting, including all our staff, our management, and we thoroughly, we do investigate that matter, because we cannot say that our staff is only guilty all the time. Okay, so we have to thoroughly investigate that matter. So, and because when the patient is admitted in the hospital, when the counseling is done by our counselor, so we do know about the patient and their relatives, how the patient is, how they will behave, how they will react. So that's how, after getting the feedback from them, definitely we do come to know who is correct. Either the patient party is correct or our employees are correct. There is a saying actually that even Superman cannot make everyone satisfied, right? If we get Superman to help us, some of us will try to find fault on him also, right? So it's something like that.
In hospital, what are the future job prospects or pathways in healthcare industry?
Sorry, as a MHA graduate. So you can join the consultancies. There are many healthcare consultancies you can join. Suppose those third-party consultancies, those who are working for NABH, NABL. I am also owning such a consultancy, my GG Helmet. So because you will have to work as a third-party service provider. So for that thing, you have to know about the hospital management and administration. Then only you can provide the knowledge to them. Okay, so you can join the consultancies. And there are few companies also, like medical tourism companies or patient facilitator companies. Okay, so they are also hiring this hospital administrator, with background with hospital administration in their companies, so that you can deal with the other hospitals to facilitate the patient. Okay, so there are many options coming up in future. Okay, yeah, please.
Good afternoon, sir. Sir, medical error is a major concern regarding patient safety. What are the other concerns that can affect patient safety? What steps you take to prevent it?
So I have already mentioned that medical error is the major concern. Okay, but you see that patient safety is not only just medical errors. There might be other errors also. Suppose our hospital is having water with iron. You got me, na? Water with iron. So that is also an error. Okay, if a patient gets spicy food from the canteen, he is not supposed to take any spicy food, but he gets spicy food from the canteen. So that is also an error. You got me, right? So these things at the end, these all are related with the patient's service only, but these are not related with the treatment. Like if there is noise pollution outside the hospital, it will harm the patient. Definitely, it will harm the patient psychologically, but that is not related to the medicine or treatment. But still, it is harming the patient. So these sort of things. So definitely, if the patient is in a dark room, it will also harm the patient, right? So nowadays, there are few things that hospitals should be in a location, should be on the location where there is very less noise pollution. You cannot avoid the noise pollution. It should be there. This, from the pollution control department, they are coming to check the quality of water that the patient is using in washrooms or in the bathrooms, wherever. So they are checking the quality of water. Then from food control department, they are coming to check the quality of food in canteens. Okay, so government is very strict regarding these things. So you cannot do any errors, you cannot commit any errors anywhere, because they are coming on sudden checkings, surprise checkings. That's the thing.